Hi, I'm Sarah Depew. I'm running for the Texas House of Representatives in District 67, and I'm here with...
My name is Lorie Burch, and I am running for the 3rd Congressional District of Texas, House of Representatives, United States Congress.
Well, thank you very much.
Thank you very much.
Okay, we can't start with that. We can't.
If you're not going to be able to handle that, then this is not going to go well.
It's
You're going to have to give me a room here to...
No, you're good. All right. So what we're doing here is we are pulling issues out of the hat completely randomly, and we don't know what we're going to
I typically carry around my issues too, so that's good.
In your hat. You just
Yeah,
keep
in my
them-
hat, just
Yes.
everywhere.
So we don't know what we're going to be talking about until we draw the issues out.
And probably not even then.
No. This has started off the rails. That's great.
It's off the cuff.
Off the cuff. So Lorie brought a hat for us to draw
Yeah, it's my
the issues
campaign
out
hat.
of her campaign hat. Do you want to? Is there a story behind the hat?
Vote
other
for
than-
Birch. Not really, just swag.
All right. Well, I hear there was supposed to be a sombrero, but
Yeah,
she came with
the
us
story is
instead.
that I was supposed to be able to go home and get my sombrero, which is pretty rockin', but I was working late because that's the life of a candidate and a small business owner trying to make a difference. So I had to come straight here and I had to grab the hat that I had. I was going to wear my thinking cap, but which has a lot of issues in it, but it's harder to pull those out.
All right. Well, let's go ahead and see what we pull out of this cap.
Cannot wait.
Go
Better
for
be a
it.
good one. What do you think it is? Okay, this better be a good one.
Death panels. Oh,
Death panels.
Healthcare.
Death panels it
Healthcare.
is.
All right. Well, so we're running for different races here. I'm running for Texas House of Representatives. She's running for U.S. Congress. So how we approach healthcare is going to be a little bit different just because the scope of the positions that we're seeking. And, so we're going to not really have too much overlap here, I think. But let's go ahead and talk about healthcare in the federal level since that's going to inform a lot of what the states can do.
Sure.
So,
Yeah, definitely.
Yeah.
I mean, is that something that's being talked about on the federal level?
it was a few months
Somewhat.
ago. Yeah, you'll have to scroll back in
Yeah.
Twitter a little bit further to find it. But
So, I mean, this is just a constant issue that has plagued our country. And we've got to find a path forward, and we have a path forward that we have, and now we're trying to dismantle that. The thing that I think that one of the things is that it gets so convoluted between actual health care and health insurance. And when we're talking about how things are paid for and then the quality of care that we get, it gets all tied into this mess of how things are getting paid for and then the actual care that people are receiving. Mm-hmm. And so this whole idea of this distraction and this partisan bickering over a repeal and replace it's just wasting our time. It's government waste. It's absolutely what's plaguing our country, is just the fact that we have representatives that are not truly trying to represent people, but are beholden to special interests and partisan politics, and we're not achieving any real change. And so there's obviously we have to address this because it affects people on every level. It affects their ability to work. It affects their ability to support their family. It affects their ability to be able to get an education. It affects our veterans, elderly. As an estate planning attorney that has spent the last 13 years doing wills and trusts, powers of attorney, and I've seen such a myriad of different people confronted with the affordability of healthcare and the ability to provide for their family, whether it's kids with special needs or they're trying to figure out how that they can take care of their aging parents, at the same time be able to take care of their kids and make sure that they can provide for their educational needs. Mm-hmm. It's something that affects us on every single level. And the fact that we've got, it's particularly in the federal government, people who don't necessarily really bear the effects or feel the effects of the decisions that they're making, which is why I think one of the biggest things we need to do is have true people that are not just for the people, but of the people actually representing, who actually know what it's like as a small business owner, as a parent, to know what it's like, the decisions that are being made and how they're affected. So just in some generalities, but allowing you to interject as far as some specific ways forward and policies is where, we've got to figure out healthcare, and that it is a fundamental right promised by our Constitution, I believe. What else does life, liberty, and the pursuit of happiness mean if being well and being able to pursue those things is not intrinsic in those values.
Well, there's definitely a lot to unpack in there. So
Good. And go.
I will. Okay, so there's a couple different approaches of talking about healthcare. There's access, there's overall cost of healthcare, and then there's helping making people healthier, because you can provide coverage for everybody in the United States, but that's going to be unsustainable given the various health conditions that are abundant. We've heard Kim Olson talk about diabetes being epidemic, but autoimmune disorders are escalating. We're seeing lots of different health issues and poor outcomes that are have to be addressed long term. So what does that look like? Because that dealing with making people healthier in a broader sense is going to actually bring down the health care
So
costs.
what? Yeah.
Oh,
Go ahead.
so-
No,
oh,
go
yeah,
ahead.
yeah. So, I think
Thought
that
that was a
kind of
question.
ties into lots of other policy areas, such as labor, safe working conditions. I think that, the EPA certainly plays a role in this, and environmental protections. Here in Collin County, just a few weeks ago, we started meeting the federal, standards for lead in the air. Up until then, we were breathing in an unacceptable amount of lead. And I didn't actually know that, but I think addressing those type of issues, water quality, air quality, what's in our food, will have long-term implications for the overall healthcare cost. States are also well positioned to do various things to bring down healthcare costs as well, such as information sharing or what have you. But a lot of those resources are dependent on what the federal government is going to provide, or what's going on there with the healthcare bill and the future of Obamacare. So you mentioned being a small business owner. I'd really be interested to hear what impact Obamacare has had on your small business at Finning.
Yeah. As far as being a business owner, actually, where it's impacted me more is being a woman and having actually a lot more covered when it comes to the insurance and things that I've had to pay before. But I mean, my premiums are still very high, and that's where we talk about care versus cost, and then covering it. So my spouse actually is also an employee, so it makes more sense for us financially, rather than covering as a spouse, covering as an employee. So that's going to trickle then to other employees that I have, to make sure that we are able to provide them health care. But I also, I have a high deductible, so that I can take advantage of a health savings account, which can help me when it comes to write-offs and taxes, and there's benefits in that. At the same time, I'm a fairly healthy person. I don't go to the doctor a lot, and I would be in a world of hurt if I had to, if anything medically significant happened, if I had to be hospitalized or came down with a medical condition. And I'll be quite frank in the fact that I actually last year had to make a decision that whether I could afford to have a mammogram, where I was saying, that's affected women's health in some ways and in other ways, but whether I could do that or afford to pay for my wedding, or buy a hot water heater, because ours busted. I mean, it's just trying to make those decisions, because I was just blown away at what the cost of what it would be. I threw out my back a couple years ago, and the cost of an MRI. And then I was talking to my stepfather and about my mom's prescriptions, and how if she wasn't covered on both TRICARE and Medicare and other options that she has as someone who's over 65, that her prescriptions would be about $9,000, and for someone like me, that it would be closer to those costs. That's not doable. That's not affordable. And so there needs to be this focus on how we can have better care, but also just these insane costs, especially with pharmaceuticals and the way that these companies, and I've actually, this is a weird part of my background, but I actually worked in the dental field for a while as a dental assistant in a dental office. That's a whole nother long story. But you
have such nice teeth. I guess.
Yeah, that's what it is. You have these pharmaceutical reps that come in, and it's just a business. It's not, this is what's best for somebody. And so then the doctors are in a position, it's like, well, I'm going to push this because I've got these incentives from companies, from businesses. And I mean, they're trying to make money, but the playing field is not very level when it comes to costs, and that still is something that really, really needs to be tackled.
Absolutely. So you talk about pharmaceuticals, and one thing that kind of came to mind of that is how much money that the federal government gives to pharmaceutical companies for research and development, and then later the same research and development costs are passed on to consumers. And so I'd be really interested to hear about what can be done to stop companies from double dipping as much.
Yeah. Well, what I think a role of a representative, of a leader, is really to get out there and talk to the community and find out really what they're facing. I mean, I can talk about me, but I'm not the only person that there is, and to also then talk to find solutions, because there are organizations, there are companies that are on the front lines that are faced with this, and it's not for me just to sit in my office and figure out, well, this is the solution, this is how it needs to be. We don't have enough interaction and dialogue with real people who are really confronted or really on the front lines of handling this to find ways forward. It's not it's not these backroom deals with a bunch of politicians. It's got to be actually talking to people, businesses, companies that are confronted with this to help develop some of those policies. I do believe that it would be a tremendous advantage for us if we move towards a Medicare for all system. Whether that's something realistic that we can accomplish, that remains to be seen. But when you look at it, when you get past all of the propaganda around it, that there is a lot that could really benefit and help bolster up our economy. Talking about how it affects the economy and the workforce. But at the very least, be able to build from what we currently have, rather than just focused on this political football of trying to repeal something because it has someone's name on it that you don't like.
Well, yeah, it has tremendous implications for the economy. How many people could start small businesses if they weren't on the hook for insurance, if the government was already taking care of that and taking care of coverage for their employees? That could probably free people up to enter, whatever business it is they want to start. But it also gets to overall cost of living, which I think everyone can agree has to be addressed. And so healthcare is a big part of that. I mean, as we know, bankruptcies are largely led by medical cost and medical billing. And then
that just drives up the cost for everybody else. I mean, that it's not just the individuals, but, as someone who is a business owner, it affects every aspect of my life, in the sense that, I had an employee who I cared for dearly that just had a lot of different medical conditions and was not in a position to be able to really work full time or maintain that kind of pace because of the kind of care that he was able to receive. And that really affects my bottom line. I don't have a lot of time to be able to stop, do a job search, train somebody, and that's just me. Apply that on this small level, but that it affects our overall economy when people are not able to work, when people are not able to return to work, or when a business is having to retrain people or find new people to get in there. Besides the just moral fact of that we're all in this together, and we should want for our neighbor to be able to have the same kind of opportunities that we have, if it weren't for our health.
Well, before we started rolling, we didn't know we were going to be talking about healthcare, but we were just talking about my family, and my husband's mom needs a lot of care, and the kind of caregiving that requires, that a lot of people aren't able to, pay somebody else to do that. So there's also a lot of elder care as, our population continues to age. There needs to be some more support in place for people who are in that sandwich generation where they're taking care of children and they're taking care of elderly parents, because I gotta tell you, that's pretty rough. Without adequate help, that's just,
and
hard.
It's rough, not just in doing what I do for a living. I mean, I see this play out day in and day out, that it's not just hard from a financial standpoint. It's hard on an emotional and physical standpoint. I mean, you only have so much stamina and bandwidth. And, we could talk about mental health care when it comes to health care, and that's something that we're really bad about in Western culture, about really addressing, and then you can get into addiction and a lot of the treatment that is available. And we focus a lot on we don't have as much focus on preventative and actual health care. We focus on sick care. And to actually try, and when you were mentioning Kim Olson, as far as, from the food we eat to the air we breathe to the water we drink, that also has a very direct effect on our health, and it's all interrelated. It would be nice for people to have that, to where people aren't as sick, they aren't as needing to rely on that, but we more reactive than proactive when it comes to taking care of our health. And I'm kind of bad at it myself.
Well, in my mind, I'm thinking it's not just environmental factors such as the air, the water, and the food, although I do think that is much bigger part than we really give it due credit for. But I think chronic stress, I think we are a stressed out culture, and that will tear apart your body. Like, there's no way around that. Like, study after study will tell you that just will break down your ability to heal. And just, we talked about autoimmune disorders and so forth like that. Like, stress is a very important role in that. So I know that's a really big nebulous thing, and I don't really know.
Let's talk about stress.
Yes, let's talk about the nation's stress level or the state's stress level. And I think that lawmakers are in a position to help that, but some of that is outside the scope as well.
Well, certainly, that this gets back to, and it's something that's also partisan football, as far as what role does government have in this, and it's a shame how things can get twisted and turned, and in the sense that in a lot of respects we could be running the government much more efficiently, and that's like the understatement of the century perhaps. But it's not necessarily as how much money is controlled, but to get government out of the way to allow people to be able to make the decisions based on the decisions that they make with their doctors, with their healthcare providers, rather than insurance companies being a go-between there and having to get the referrals and having to go this and having to do that. I mean, I belonged to an HMO a while ago when I worked at an endodontist office, which is again another whole part of my story. But I mean, I went to an insurance building to see doctors, and they told me who I could see. And I couldn't, I could tell you my knee hurts, but I couldn't go see an orthopedic surgeon. I had to go to this doctor to get a referral, and the insurance company had to approve that. And to be able to take all that red tape out of it and be able to allow us to make those decisions is something that I think is very appealing about a universal healthcare system. And it's not a matter of having to get more money, it's using money more efficiently, and that's something that definitely being a business owner I've had to learn how to do, is that you have your budget and you have to figure out how to best allocate that to have the best effect, and we have such wasteful spending. So it's not just a matter of government should not be in control of certain things. It's that government needs to be using these funds more efficiently and get out of the way where other people need to be making decisions more intimately with the care providers that they're seeing.
Now, to kind of get to something that you said really early on about it being a right, a constitutional right, I kind of want to dig into that for a little bit, if that's okay, because I think it's a very good thing to have. And I think that, voters can elect people who, think that it's a good thing to have and are committed to making, universal coverage and all that, and that's great. But that doesn't necessarily make it a constitutional right. And I'd really like to hear more about your thought on that as to...
Yeah, well, I mean, one of the beauties of our country, of our Constitution, is it does come with a Bill of Rights, with constitutional principles as far as how we are going to function as a society, and be able to have opportunities to be able to pursue the same type of levels of success and prosperity as our neighbor, regardless of race, religion, income, socioeconomic status. And that ties into it, because for those who have higher means, they aren't necessarily having this discussion. I mean, it comes down to access. It comes down to opportunity. It comes down to, we can talk all day about being able to, go to school, have an education, get a job, work hard. All you got to do is just work hard. Well, if you're sick, or you're taking care of a sick kid or a sick parent, you don't have that opportunity. And, fundamentally it's the most inalienable right, is being able to acknowledge that if you don't have health, you don't have anything. And so it's not necessarily an obligation, it's just something intrinsically that we are entitled to as human beings to live in a society, to be able to have the opportunity to prosper and get ahead and make a life for ourselves and our family. But if you don't have your health, it's not possible to do that.
Yeah. Well, I could be wrong in this. How I understood that was that the government doesn't have a right to impede your health or your life or anything like that, but not necessarily like they're not compelled to provide these services as well.
No,
even though I do think it's a good thing.
But we perpetuate a system that continues to allow those who have means to continue to have means and build wealth, while the system for middle class and lower class are the ones that get pushed aside and don't have the same sort of access and opportunity.
That's very true.
So it's
no disagreement there. I actually went most of my life without health insurance.
Right. So we're living with a government system that perpetuates that. So get out of the way, allow those opportunities to have a more equal playing field for all of our citizens, rather than perpetuating the higher end, the elite, to be able to take care of themselves and get their tax breaks and be able to not pay anything or hardly anything, and they don't have to worry about it. They still get sick, but they can afford it.
Yeah.
They have the means to do that.
There, very different stressors on your life. And I could tell you, I've been pregnant 3 times, and all 3 were complicated pregnancies. And I was fortunate enough to be able to take the bed rest when needed and so forth. But I can't, the stress must have been unimaginable if you're a mom who wasn't able to do that, who have to keep showing up, even though you're putting, your health and the health of, your unborn child or whatever, on the line as well, by continuing to show up to work every single day against doctor's orders. And there's really not adequate protections in those situations, or if you couldn't afford to keep going to those appointments, or if you couldn't afford to be in the hospital for a week to be monitored, or what have you, or, so it's definitely very stressful.
And I think too, we look at it, when people want to say that, I don't have a responsibility to pay for someone's health care. And it's like, well, I mean, you're paying into that system all the time, but it's really a benefit to the greater good, because if you don't have any sort of moral obligation or don't buy into the fact that it is a fundamental right for people, then just look at the bare bones. It is a strain on our economy when people are sick. From the workforce to education to, I mean, I'm such a little example of having to retrain, rehire, do all of that. I mean, you're going to pay for it whether you realize or not. The bankruptcies and the plugging up the court system, the bureaucracy, the cost of everything goes up because of that. I mean, you're paying for it anyway. More.
Yes, you pay more for it this way, and so you can get ahead of it and have some, adequate care for people and prevention, and deal with the other things that I feel are also necessary to kind of bring down the overall cost of healthcare. Because I don't believe, just like I said at the very beginning, that providing blanket access is going to be sustainable unless we actually deal with the underlying costs. And so, I think that's going to be crucial. But
and where do those costs come from? I mean, how are they set? Why is it, depending on what insurance company you have, why the same service costs this amount, but it costs 5 times as much with a different insurance company?
Well, in providing access, especially when you're talking about, I'm really glad you mentioned mental health and substance abuse services. Like, what that means, not just for our economy, but the vibrancy of our communities, is just so important. I worked for, worked for CPS for 5 years and been a CASA volunteer for 4. And I've worked with, I don't know exactly how many families or kids, but, over 100. And I can tell you that substance abuse was a factor in almost all of them. And so if you just want to be totally shrewd and say, okay, let's just look at the bottom line here, you are going to save more keeping kids out of the system by providing adequate services to parents than you would just kind of letting things play out as they currently are. And the opioid epidemic is not getting better at the moment. It's just not. And so if you want to see fewer kids coming into foster care, and if you want the state paying for less of that care, then provide adequate services before it gets to that point. Actually provide real options. And the bottom line isn't that important to you, if you want to focus on the humanitarian, you can think about all those families that remain intact, children that get to remain in their families of origin, and you also have physical, tangible lives of children that are saved, because neglect and substance abuse is a big part of neglect, is actually the biggest leading cause of death for children for maltreatment. And you put it in that maltreatment umbrella. Neglect there is actually the biggest killer. And
that's interrelated, especially with mental health and substance abuse too. If you look at what happened in the 80s, where everything was, the mental health treatments and facilities were deinstitutionalized, and it sends people out. They don't have the means. They don't, get a job, right? But they don't have the mental ability to get a job, so they become homeless. So crime gets increased, the homelessness population gets increased, and it's just so sad. And I mean, these are veterans. These are people who have fought for our country.
And former foster youth too.
That are on the streets merely because that system has been deregulated. Government's out of it. So great, now you literally are on your own on the street, not able to work, not able to put clothes on your back, food in your belly, and certainly not able to take care of your health.
And I'm definitely all for smaller government in a lot of areas, but I think we also have to be very wise with our public investments. And
we need efficient government.
Yes.
Big, small, those are just red herrings. We just need efficient government. We need to get back to how it's meant to be able to help people have more access, equal opportunity, and justice, and create those opportunities and allow for innovation, allow for people to get ahead, allow for families to grow, allow for small businesses and entrepreneurs, and not get in the way, not perpetuate policies and regulations that are going to prevent those fundamental values of the American principles that we're talking about.
Well, we want a system that works. Plain and simple. We want something that works. It is consistent with our values.
Right.
We definitely want that. And so I think getting ahead of these issues.
So for you, Sarah, then at the state versus federal level, how do you see things playing out on the state level when it comes to all that's been unpacked when it comes to healthcare issues?
Well, I mean, I think how it plays out is going to matter a lot about how the federal stuff works itself out. However, we may be able to accept additional federal money if legislators choose to do that. That is a resource that's available currently that's not being utilized. I don't know how long that resource is going to be there, but if it remains there, that is something that we could take advantage of and expand access to people here in Texas, which I think would be a great thing, especially in the context of drug treatment and mental health services that we were just talking about. And again, that's my child welfare lens that's really honed in as a big issue for me. But I also see, different policies such as not fighting the federal government so much on our air and water quality. We have spent millions of dollars litigating cases, fighting the federal government for mercury in our water. How does that? And we have some 65 communities here in Texas whose water is unfit for human consumption, where it's not safe to just turn on your tap, drink your water, bathe your kid. That's crazy to me. That is not going to have good long-term outcomes for the people in those communities. And so I think being very protective of, and it's not like you get to opt in and out of breathing the air in your neighborhood. You know what I'm saying? That's not something you have a choice in. So if you're going to increase the community's, risk for cancer by, double digits or what have you, I think if you're, at the very, very least, if the state isn't going to do more to protect those members of our community, then they should also allow true due process and allow them to sue when they have an injury that they can trace back to a root cause. Not put so many barriers in the way of people getting justice or protecting themselves. I very much see this as a self-defense issue. When people say self-defense, I think that's great, but I think self-defense is a lot more than you can point a gun at. And I think that, there are more threats to our well-being and to the well-being of our kids than someone coming through our door robbing our stuff. I think that there's these unseen, pervasive issues that are like just slowly chipping away at our health and well-being. And so I think a lot of those are tackleable on the state level, very much.
Yeah,
So.
and the government needs to be able to provide a means and also a way to allow states then to be able to implement that to best treat all of their citizens and not just the ones who have the means to be able to take care of themselves.
Everybody is of equal value, absolutely.
Yes.
That's a no-brainer. Like,
Well,
it is
it
such a
should
no-brainer.
be, but it you know, when you really dissect some of these arguments that you hear, that is not how things are currently implemented, but that should be the foundation of where we're going with this, which is the foundation of saying that healthcare in life is a fundamental right.
Well, okay, so I quibble over the terms a little bit, you know, but I think that our value is the same on it, whether or not we feel that the government, you know, is like compelled to provide that, I guess. I think is a little bit different.
No, they're compelled not to get in the way of it. And to not perpetuate means that perpetuate the inequality and the lack of access.
Total agreement there.
Yeah, all right.
All right, well, I think that, do you have anything else you want to say about healthcare?
We'll let the other pundits get in on that.
Yeah, lots to dig in here. Okay, so if you have any issue that you want to see a candidate address in the future, just type it in the comments or send me a message or whatever you want to do, but just let me know and we will add it to a hat and maybe it'll be drawn next time or time after that.
Yeah,
anyhow.
awesome.
Well, thank you so much, Lorie. I really appreciate
thank you,
you
Sarah.
coming out.
LorieBurchForCongress.com. Check us out.
Sarah Depew for Texas House of Representatives, District 67. All right, bye.
Bye-bye.